आती है. So it's not a new entity for the world. It's a very old entity. But लखनऊ के लिए थोड़ा नया यहाँ पे establishment हुआ है. I have worked with Hathaway Oxygen Therapy Unit at Apollo Delhi between 2006 and 2010. Dr. Pankaj Srivastava is from KGMC Lucknow. He is MBBS and MD at KGMC, and he's basically a ENT surgeon. He has his own HPOT clinic in Lucknow, Mahanagar, and the rest Dr. Pankaj will guide on it. Thank you. Thank you.
Good morning, seniors, friends. I thank Shekhar Hospital and Dr. Kanoja for giving me this opportunity. It's a new thing. We have been studying medical science, and it's a new addition to medical science, so it will be interesting and something new for you. This is our center. Now, what is hyperbaric oxygen therapy? It is used in both wellness and illness. So, healthy person and a diseased person, it is useful for both. So, I will be taking both simultaneously. Now, what is aging? First thing, aging happens at two levels. One is at chromosome level.
शरीर में मौजूद DNA से तैयार होते हैं और क्रोमोसोम्स में किसी
At chromosomal level, we have telomeres at the ends, and that telomere is slowly decayed down with the age. And when the telomere size is reduced, it responds to aging, and every cell responds to this length of the telomere. So when chromosome is disturbed, our performance of every tissue is disturbed. That is aging. Changes in the face, changes in the skin, osteoarthritis, whatever is there. So that responds to this. If we can reduce this, if we can reverse this, definitely there will be a reversal in the age. It is not that you will be becoming a child, young or child, but definitely the diseases, the aging process is delayed, and we can stay young for a long time.
शरीर में मौजूद DNA से तैयार होते हैं और क्रोमोसोम्स में किसी भी जीन की पूरी जेनेटिक जानकारी छिपी होती है और इन्हीं क्रोमोसोम्स के आखिरी सिरे को
I'll come later on this. Now, coming to disease part. What is disease? In some diseases, where there is a supply of the vessels, supply of the blood is reduced, that becomes reduced in the nutrition supply, reduced in the oxygen supply, and there is a reduce in the healing cells. So these three factors are responsible in non-healing ulcers, non-healing diseases, and something like that. So if we can replenish this oxygen, nutrition, and pluripotent cell, which is important for healing, we will be reversing the disease process. Coming to oxygen transport, how oxygen is carried to the tissue. Now we all know that we have red blood cells in the our blood, and there is a plasma. Red blood cell is responsible for carrying oxygen from lungs to the tissue and taking out carbon dioxide from the tissues to the lung. So when we breathe in oxygen, the red blood cells are saturated and they deliver oxygen to the tissues. When we breathe 21% oxygen, which is present in the atmosphere, almost 100% of the blood cells are satisfied. If we increase the oxygen concentration in breathing air, suppose we are breathing 100% oxygen, only the red cells will be satisfied and there will be no increase in oxygen carrying capacity of the blood. So there is no use of a healthy person where the lung and the blood, hemoglobin and everything is normal. There is no use of increasing oxygen percentage. So the carrying capacity of the oxygen of blood is not changed by increasing the concentration of the oxygen. So this is one limitation. How we can increase the oxygen carrying capacity of the blood? Just see a small video.
Under normal conditions, it is difficult to dissolve excess carbon dioxide in water. Only a certain
in soda water, what happens? There is a plain water or a cold drink or something like that, and we try to dissolve carbon dioxide in this water by increasing the pressure. When the pressure is increased, carbon dioxide is dissolved in the water and sealed by a cap. Whenever the cap is opened, suddenly the carbon dioxide goes up. So that is one possibility by the physics how we can increase the gas carrying capacity.
dissolves easily. Hence, retain that distinctive flavor, excess carbon dioxide is dissolved in water under high pressure and low temperature. Due to this technique, the water molecules enclose and trap extra carbon dioxide molecules to prevent them from escaping. Once the excess carbon dioxide is trapped by the water molecules, the bottles are sealed with an airtight cap. This helps maintain pressure inside the bottle, and hence, this is because when the bottle is opened, the pressure in the bottle.
So now we can use plasma for carrying oxygen from lungs to the tissue. That is one way. So how can we do that? We can increase the pressure where we breathe so that the oxygen is dissolved in the plasma. Now red blood cells are not used, plasma is used so that the oxygen carrying capacity of the blood becomes 4 times or 5 times of the. So now what is 1 atmospheric pressure? This is a simple physics experiment where the drum is filled by the steam and we try to cool it. When the steam is cooled down, there is a 1 atmospheric pressure which is present always, and that compresses the drum. So we saw what is 1 atmospheric pressure, but we are used to that. So when we increase the atmospheric pressure in our chamber, this is our hyperbaric chamber, that goes from 2.4 to 3 atmospheric pressure. We can imagine how much the pressure would be inside the chamber, but that is not a problematic thing. When we breathe oxygen at this pressure, our plasma is satisfied or saturated by the oxygen, now which is delivered to every tissue which is deprived of oxygen. So we can increase the oxygen carrying capacity till the tissue which is being gangrenous, flap is being closed, or diabetic foot is there, whatever it is. So now we can increase the oxygen carrying capacity safely 4 or 5 times. Second is nutrition. We all know nutrition is the most cheapest thing. So we have vitamins, we have everything what is needed for the tissue, for the healing. But there is a problem of reaching that nutrition to the end disease part. So oxygen therapy, hyperbaric oxygen therapy, when it is given for more than 10 sittings, there is a neovascularization. Vessels are dilated vessels, the new vessels are being formed. So not only the oxygen carrying capacity is increased, after 10 sittings, we get new vessels, new granulations are formed, and then everything whatever is needed for the tissue healing, even the nutrition, the protective cells, the healing cells, they also reach the end tissue. And third most important is pluripotent cell. We all know when there is healing is required, we need tissue. If there is a spinal injury, we need nerve tissue. When there is a brain injury, we need nerve tissue. When there is a collagen or face trauma is there, we need collagen or something like that. So stem cell is one pluripotent cell which turns into every cell, myocardial cell, neural cell, or collagen, whatever is needed. So hyperbaric oxygen therapy increases stem cell activity also. So we increase all the 3 components, whatever we need for reversal of the aging, youthness, or disease healing process. So that is the principle of the hyperbaric oxygen.
But what interests?
There are many researches which prove that yes, oxygen is needed for tissue healing and age reversal. So this was in 2019. Nobel Prize was given for to these physics persons. The topic was how cells sense and adapt to oxygen availability. This was not directly related to hyperbaric therapy, but yes, they proved that the cells which are diseased or normal cells, they respond very well to oxygen availability or unavailability. So oxygen is important for healing. So this is one news which
वैज्ञानिकों ने एक ऐसी क्रांतिकारी रिसर्च की है जिससे आप हमेशा जवान बने रहेंगे और आपकी उम्र बढ़ना बंद हो जाएगी और आप 75 साल की उम्र में भी 25 साल के जवान जैसा शरीर हासिल करता है, क्योंकि जिन बुजुर्गों पर यह प्रयोग किया गया उनका शरीर अब 25 वर्ष के युवाओं जैसा हो गया। उनके लिए नहीं बल्कि दुनिया के हर व्यक्ति के लिए एक वरदान साबित हो जाएगी, क्योंकि दुनिया के सभी लोग एक ही चीज को चाहते हैं और वो ये कि वो हमेशा जवान बने रहें, उन्हें मृत्यु से छुटकारा मिल जाए और बुढ़ापे से भी छुटकारा मिल जाए। ये दुनिया भर के वैज्ञानिक और डॉक्टर बहुत पुरानी ज़माने से ये रिसर्च करते आ रहे हैं। ये रिसर्च इजराइल की टेल अवीव यूनिवर्सिटी और शामीर मेडिकल सेंटर के वैज्ञानिकों ने किया और इस रिसर्च में 64 वर्ष से ज़्यादा उम्र के 35 लोगों को शामिल किया गया। इनमें से किसी भी व्यक्ति को स्वास्थ्य संबंधी कोई गंभीर बीमारी नहीं। इन 35 लोगों को हफ्ते में 5 दिन 90 मिनट के लिए शुद्ध ऑक्सीजन दी जाती। इसके लिए इन बुजुर्गों को एक प्रेशराइज्ड चेंबर में भेजा जाता था और ये सिलसिला 3 महीने तक ऐसे ही चलता रहा। लेकिन जब इसके नतीजे आए तो इसने दुनिया भर के वैज्ञानिकों को हैरान कर दिया और आज आप भी हैरान हो जाएंगे। ये खबर बहुत इजराइल
We don't believe on news, but this news was based on a research which was done in Israel, and I'll give you a small clip of that original research. So everything is going on about hyperbaric oxygen therapy all over the world for last 20 years. So this is not new. And celebrities, people who are in sports, athletes, they all take hyperbaric therapy from time to time for their reversal, disease healing, or sports injury healing. We have, this is Shri Ravi Shankar.
No.
This is the unit being installed at the same time when we were installing this. The same unit is installed at Bangalore at Ayurvedic Hospital of Shri Ravi Shankar, and this is our unit. This was the original research.
But it's a tissue. A simple tissue with a simple wound. It's not a simple wound, it can be a complex wound. But the same dimensions that holds over here holds also for this complex tissue. We can visualize this area. We can visualize it with different metabolic imaging of the brain that we can do.
The principle of this is whenever there is an injury, maybe it's a brain injury, stroke or anything, or there is a tissue injury, there is all deprivation of the three things, oxygen, nutrition and stem cells. And whenever the hyperbaric oxygen therapy was given to these patients, there was metabolically and physically reversal of the disease process. So just a small clip.
PET CTs, PET scan, etc., etc. And we can see an aquatic tissue, which is the blue area over here, and the surrounding is the metabolic dysfunction area. This is where we are targeting our treatment. And this area can persist for years after the acute event. One of the major things that we proved is that oxygen is indeed a rate limiting factor for brain recovery. And the first proof for that is coming from patients that have severe traumatic brain injury. Why is that? Because in patients with severe traumatic brain injury, we have the licensing to attack the patient and be in direct contact with the brain. You know that we are inserting different catheters. And this is an amazing study that was done, which took place.
I'll just bypass this, the message I have given you. Now, what are the chambers type? We have two types of chambers. One is monoplace therapy and second is multiplace therapy. In monoplace therapy, there is a single chamber. It's a capsule-like thing and person has to lie down inside that chamber. That's a fancy acrylic covering, but the limitation is we cannot increase the pressure beyond 1.5 atmospheric pressure. So that's a small pressure machine. And we have a multiplace chamber where 4 persons can sit at one time. There is a stretcher for a lying patient or a patient who cannot sit, and 3 others can sit. So this is a multiplace chamber. We can increase the pressure from 2.4 to 3 atmospheric pressure, which is too much and adequately needed for any healing process.
कैंसर आदि के लिए बहुत ज्यादा डॉक्टर हैं। देश में हर साल 1,70,000 रैंक शुगर के जख्म के कारण काटने पड़ते हैं। FDA अमेरिका से अप्रूव हाइपरबैरिक ऑक्सीजन थेरेपी जख्म को ठीक कर अंग को कटने से बचा सकती है।
That was the principle, that was the machine. Now, how we can use, where we can use this hyperbaric oxygen therapy? Absolutely, in every specialty, there is a need for hyperbaric oxygen therapy. This is not a replacement of medical treatment. This diseases just add on to the medical treatment. There are still some diseases where only HBOT is the answer. We will come on that. So clinical, medical involvement, sports injuries, performance increasing in the athletes, cosmetic, anti-aging, skin toning. Now there's a new movement that's a post-COVID rehabilitation. There are some US FDA approved indications. There are some off-label indications, and general fatigue and everything, insomnia, that is all taken care by this hyperbaric oxygen therapy. Now, there are some diseases like air or gas embolism where medical treatment comes second to the hyperbaric. If it is available, HBOT is the first line of treatment. Air or gas embolism, carbon monoxide poisoning. We have many times we have a fire accidents going on somewhere or other, and people who are exposed to smoke and fire, they are diseased, they are in shock. So HBOT is the first line of treatment. If they are kept in an oxygen chamber for 2 hours, 1.5 hours, 2 times a day, in 1 day or 2 days, they reverse the problem. Gas gangrene, we all know that's a life-threatening situation. HBOT is the first line of treatment. Crush injury, compartment syndrome where edema is there, the tissue is in risk, there is a possibility of gangrene or amputation, that is the first line of treatment. Decompression sickness where the divers go inside the sea, that is the first line of treatment. Arterial insufficiencies like sudden retinal artery involvement, sudden sensorineural loss, that is the first line of treatment. In other diseases, we add this treatment with the proper medical or surgical treatment which is going on under specialists. Now the theory is the patient of a plastic surgeon or patient of an orthopedic surgeon which is not healing or flap necrosis or gangrene is progressing. So we keep the patient under that specialty, under that specialist, and we give 10, 15, 30, whatever is needed settings and refer back to the surgeon, and then he continues for by amputation, whatever is needed, and skin graft or whatever is. Further, some indications are there: sudden sensorineural hearing loss, intracranial abscess, necrotizing soft tissue infections, osteomyelitis, which is not healing by antibiotics, debridement. If 10 to 5 settings of HBOT is given, patient response. Osteomyelitis, delayed radiation injury. Most of our patients come from radiation department, from Tata, from this AGI, or everywhere, where the post-radiation injury is there, skin is deformed, there is a necrosis, mandible sometimes get necrosed, there is a non-healing ulcer, discharging ulcer. So these are the patients who don't respond to medical treatment. They are the patients who get most benefited. And the most, 80% of our patients are diabetic, nephropathy, diabetic foot, where antibiotics and everything does not work. We give and there's a good response. If a plastic surgeon has put some graft, skin graft or something there, and that is the ends are getting necrosed, so we give oxygen therapy and we can save the graft. So those are the indications. In children, autism, cerebral palsy, post-delivery oxygen, that is asphyxia. So these are the patients who also get spots. So these are multiple indications in almost every specialty. Sports in the medicine, it's a totally different thing. We can increase the performance, and if there is a sport injury, suppose there is an athlete and he has got some injury, and medical person has said that you need 10 days rest, and he need to go somewhere for a competition or something. If we give hyperbaric oxygen therapy, he can be fit in 3 or 2 days. So that is time saving and cost saving mechanism. So these are some of our patients who had responded to oxygen therapy. So this was a wound, it was an active foot. So this wound was not responding to medicine for many days, and he was advised amputation. So we had given oxygen therapy. This is serial wise. This is on 3rd day. This was on 10th day, and ultimately you see only by oxygen therapy the wound has healed. He was a diabetic. So this is a second patient. It was he was already amputated. The ankle is not there. So there was a non-healing ulcer, and with 3 or 4 settings, the granulations have started. This patient was referred back to the surgeon and whatever they did. This was the second one, third one, a non-healing ulcer. Ultimately, you see, this is a small ulcer. In a normal person, this is not a problem, never a problem. This will heal by itself. But in diabetes, where the peripheral neuropathy has settled in, even this small ulcer can increase to a size where amputation is needed, or there's a severe pain or problematic things. So very small ulcers in diabetic foot, they don't respond, and we need SBOT for that. So this was our fourth one who was amputated, and you can see the end. There is no vascularity. There is almost gangrenous skin. There is no healing process which is being seen. After 18 drives, you can see the redness which has increased. New vessels have formed. Granulations are there. So this will ultimately heal. We don't expect everything by hyperbaric oxygen therapy. We just provide the bed. We increase the vascularity. We refer these patients back to the plastic surgeon. They then put a skin graft or whatever that is needed for specialty. So we help those specialties to heal their patients. So you can see that the third toe is being gangrenous, and after 10 days of hyperbaric oxygen therapy, we can save the finger of the patient. Now what we say is that you can see the black portion of the finger which is being gangrenous, but his say 10 inches of the foot is being involved. The previous 10 inches of the foot is diseased and it may go gangrenous. Amputation may be needed at a higher level. So when we give hyperbaric oxygen therapy, we can actually save the toe, or we can reduce the level of the amputation. Suppose amputation is needed at this level, we can save this much amputation may be needed at this level. So we get something. That is not that 100% you send the patient and will go. This is not. This is the proper FDA approved allopathic treatment. This is nothing like a tantric or something like that. You send us and we'll go there. See, the granulations have increased. Neuropathy patients have severe pain sometimes, tingling sensation, abnormal sensations. They don't have sensation, that is the problem. And after hyperbaric oxygen therapy, the sensation increase, the mobility of the patient increase. This is also very important. This is how we treat our children. So in a child, we allow one parent inside the chamber for the support, and we have a special trainer at our center. They support the children. So because sometimes the children are very problematic, they don't clear the hood and they don't sit inside. So this is how we treat our children. We have TV monitors, we have music inside the channel. So ultimately they all sit there in the spot. Carbon monoxide poisoning, this is a dramatic. We give 5 sittings only when the patient is exposed to smoke or something, breathless or This is what I was using for a long time, and we were sending our patients to Delhi Apollo for hyperbaric oxygen therapy. We have sudden sensory neural loss without any cause. It's called idiopathic or autoimmune or something like that. Patient is sitting and suddenly 1 year is gone, 0. So hyperbaric oxygen therapy is very useful in these patients. 3, 4 out of 10 they get response and the healing returns back. So this is where I started, and we were sending patients to Delhi, and when we saw that there's a response, then we planned that we should have this in the clinic. This is most important, not in cancer treatment, but when the patient is being treated, when there is a flap operation has been done, flap necrosis is there, or after radiotherapy. Whatever the problems of radiotherapy are there, we can reduce them, we can reverse it. This is one of the patients who was under radiation therapy. This mandible is exposed. There was a chronic discharging sinus for 1.5 years. We gave oxygen therapy, and you see, patient is relieved of this non-healing ulcer. Post-radiation osteonecrosis, mostly in the mandible is involved. This saw one patient. Others are also involved. Post-radiation proctitis, this was one of the patients. We have some of the testimonials. insomnia, general fatigue, post-COVID fatigue. This is also very useful.
हमको नींद नहीं आ रही थी, आपके बनाने से नींद हमको फ्री में आई और आज यहाँ तक मुझे घाव है, घाव भी काफ़ी मतलब अच्छा हुआ है। नींद प्रोसेस था वो स्टॉप हो चुका था, अभी वो नींद प्रोसेस ठीक हो गया है।
You are a medical person. It was operated by me, and after post-sedation, he had inside there was a discharge, and he was here by this.
ये मैं मेडिटेशन बोला था, वो मेडिटेशन को समझता हूँ। तो उसमें मुझे डॉक्टर ने एडवाइस किया कि आपका हाइपर बैक एक्टिविटी नहीं है। तो मैं आपके पास आया, तब प्लीज हमें पहले आपका आपका फायदा है।
Where else it is available? It is available very well in Lucknow for the last 2 years, 3 years. It is available in KGMC, Plastic Surgery Department. There is a monoplace chamber they use in their burn patients. This is available at RML also in ICU. This is available they use for their own patients. So this is nothing new for the Lucknow, but in private definitely it is. And it is available at Safai, it is available at AIMS Rishikesh, available at AIMS Delhi, Apollo Delhi. So in Lucknow or nearby it is there. So that is availability, this is nothing new.